Hi, my name is Madeline and I'm going to be your nurse today. And today we'll be performing a head-to-toe assessment. Some equipment that I brought with me is my watch, I have my stethoscope, I have some hand hygiene equipment, my pen light, floss to help with my teaching, and I just have some visual aids to help test for visual acuity. At this time, I'm going to ask the patient to tell me your name.
My name is Bella Boo.
Hi, Bella Boo. Very nice to meet you. And can you tell me when is your birthday?
November.
November what?
November,
I think November 22nd. Wow, that's right around the corner. Congratulations. Are you having a birthday party? Wow. Well,
and a birthday.
And a birthday. That's right. You got to have a birthday to have a birthday party. All right. And can you tell me what room are you in?
A doctor room.
A doctor's room. Okay. And is it daytime or nighttime?
Daytime.
Daytime. Very good. High five. So clearly the patient is alert and oriented ×3. So now we're going to move and jump into testing our cranial nerve function, beginning with our eyes. All right, sweetheart, can you go ahead and stand up? All right, and I'm going to need you to go to the door. And some visual aids I have is I'm going to be asking the patient to tell me a letter, an animal, and a color. So this is going to help us test her cranial nerve function. So now I'm going to go ahead and back up so that we have a great distance to assess the patient. All right, sweetheart. Can you cover your right eye for me? Other one. There we go. All right, and what letter is this?
B.
Good girl. All right, put your hand down. Cover your left eye. Very good. And what animal do you see?
A dog.
Good job. All right, now put both hands down and with both eyes, what color is this letter?
Orange.
Very good. Awesome. So you can come back up here. And so the patient got all 3 answers correct at a distance, or her visual acuity seems to be clear. And I'm going to go ahead and take this time to look at the patient's pupils using my pen light. I forgot to perform some hand hygiene, so I'm going to go ahead and do that now. All right. So with my pen light, I'm going to go ahead and turn it on and look at the patient's eyes. Can you look at me, baby? Look at my nose. All right. I'm going to cover one eye. Open. All right. Look at me, my nose. All right, and I'm going to go ahead and look at this eye. Look at me, my nose. Very good. So the patient's eyes did constrict and dilate in reaction to the light, and the pupils were equal and round. So I'm going to go ahead and label the patient's eyes, pupils as Perla. And at this time, I'm also going to be assessing the patient's eye movements. All right, sweetheart. So with your eyes and not your head, I need you to follow my pen with your eyes, okay? So put your hand down. All right, you ready? Not with your head, just your eyes. Look, follow the pin. The pin. Good. 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 Follow the pin. Good. Good. Don't move your head, just your eyes. Pin. Pin. There we go. There we go. And I'm coming into your nose. Good. So the patient was able to move her eyes in all the extraocular arenas, and she was also, her eyes did accommodate when I moved the pen closer to her nose. So now we're going to go ahead and move on to testing facial cranial nerves. So first I'm going to have the patient show me her big, beautiful smile. Happy, ooh, wow, look at those pearly whites. And now I'm going to have you frown. Let me see that mad face. All right, so when she did those 2 faces, I was able to look at her eyebrows, and they both rose and fell. So that cranial nerve is intact. And now I want you to do the puffer fish. Hold it. Awesome. So the patient's facial cranial nerve is intact as well. Now I'm going to have the patient stick out their tongue. Move it side to side. Awesome. And I want to go ahead and look at your uvula. So we'll Oh, all right. So we were able to see the uvula rise at that time. Now we're going to move on and test the patient's hearing using our finger rub. So we're going to go ahead and turn the patient around. All right, sweetheart. So this is what I'm going to have you do. When you hear this sound, I want you to raise your hand on the side you heard it, okay? All right. So go ahead. Close your eyes. Awesome. Hand down. Awesome. So the patient's hearing is intact. Now we're going to go ahead and we're going to move on to something new. We're going to try the shoulder shrugs. All right, baby. So to shrug your shoulders, you're going to go up and down with your shoulders. All right. So let me see you do it. Awesome. Ooh, look at them dance moves. All right. Good job, baby girl. And so I heard that you're super strong. Is that right? All right. So I need you to squeeze my hands, but don't break it. Just a little squeeze. Just squeeze. Oh, wow. So the patient's grip is definitely +5 out of 5. So she's doing good. And while I'm here, let's go ahead and test the strength of the upper extremities and the lower extremities. All right, sweetheart. So look at me. I'm going to try to push your hands down, but I want you to pull them up, okay? Ready? Go ahead. Oh, wow. She's strong. Let's try her legs. Same thing. I'm going to try to push them down, but you push them up, okay? Go ahead. All right. So upper and lower extremity strength is +5 out of 5. Now we're gonna go ahead and move on to the integumentary. So as I'm looking here assessing the patient, I can see that her skin color is evenly distributed, and right now I'm not noticing any lesions. But I'm gonna go ahead and lift up these arms. All right. Go ahead and turn this way for the camera. And I do know a scar present on the upper right arm near the shoulder. Sweetheart, can you tell me what happened? How did you get this scar here?
The dog bit me.
Bit? It looks more like a scratch, but we'll definitely make sure to note that in our assessment. So now, as I'm also touching the patient, I feel that the patient is warm, and I'm going to go ahead and test skin suture up on the clavicle here by pinching a little bit of skin. And it immediately smooths back down, so she is clearly hydrated. Moving on, we're going to go ahead and begin our assessment of the respiratory system. So this is the time I'm going to take to assess the patient. And while I'm assessing, I might as well go ahead and take this time to count her respiratory rate for 1 full minute. And just continue doing what you're doing, all right? All right, and the patient's respiratory rate was at 28. And while I was counting her respirations, I was also looking at her chest rise and fall. And both sides of her chest rose and fell at an equal expansion. And the anterior to posterior expansion is about 2 to 1. And also no accessory muscles were being used as she was breathing. Now I'm going to go ahead and take my stethoscope and listen to some breath sounds. All right, sweetheart. So over the course of the next couple minutes, I'm going to be asking you to take a couple deep breaths, okay? And we're going to focus on placement now. And I'm going to be using the diaphragm of my stethoscope to listen to these breath sounds. All right. Deep breath. Out. In. In through the nose. In. Out. All right. And on the right side, the patient has 3 lobes. So I'm going to go ahead and try to assess that as well. Arm up, 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 up. All right. Deep breath. Deep breath. In. Out. And on the left side, she has 2 lobes. So I'm going to go ahead and assess those 2 lobes. Arms up. Deep breath. Out. In. Out. All right. And now I'm going to listen to her posteriorly. So go ahead and turn around for me, sweetheart. Full circle, full circle. Awesome. And I'm going to need you to take a deep breath in. Out. Good. In. Out. Good. In. Out. In. Out. All right. Stop the movement. In. Out. In. Out. In. Out. In, out. In, out. All right, so the patient had clear breath sounds bilaterally. No adventitious sounds were heard, and I'm glad to see that. So now we're going to go ahead and move on and continue to assess. Oh, wow, thank you. Helps keep my teeth straight. Now we're going to continue and move on to assess the cardiovascular system. And I'm going to begin by listening to her heart sounds, and then we're also going to listen to the carotids as well. So let's begin with the carotids. With the carotids, we want to be using the bell of our stethoscope because it makes the sounds distinct. So I'm going to have the patient hold their breath, listen, breathe out, hold their breath, listen, and breathe out. All right, sweetheart. Take a deep breath in and hold it. Good. And then take a deep breath out. Breathe out. All right, breathe in. Hold it. Good. All right, so during auscultating her carotids, I heard no bruits and I felt no thrills. So that's good news to hear. And now we're going to go ahead and move on, and we're going to be assessing the heart sounds. So I'm going to listen both with the diaphragm and going to listen with the bell of my stethoscope because the bell will help me identify any murmurs if they're present. So we're going to begin with the diaphragm, making sure that it's on. Good to go. All right, sweetheart. So you just do your own thing, and I'm going to listen to your heart. I'm going to begin here at the aortic placement. Slide on over to pulmonic. I'm going to go down one intercostal space and go to Erb's point. Go down two intercostal spaces and go to tricuspid. And move slightly over to the left fifth clavicular line. And we're going to listen to the apical pulse for 1 full minute. All right, so the apical pulse here was 109 beats per minute. Now I'm going to go ahead and switch my stethoscope to be back on the bell. There we go. And I'm going to go ahead and go back in a backward formation to listen to these heart sounds again. Beginning here at the mitral. Sliding over to tricuspid. Going up 2 intercostal spaces to Erb's point. Moving 1 intercostal space up to pulmonic. And on over to the right and listening to the apical pulse. I mean the mitral valve, aortic valve. All right, so no murmurs were heard. S1 and S2 heart sounds were identified. And now we're going to be moving on to assessing the patient's pulses. You tired already? Come on. We got to get it going. All right, so I'm going to go ahead and first begin with the patient's radial pulse on the right hand. And checking in the left hand as well. Radial pulses are +2 bilaterally. We're going to go down and we're going to check the, beginning with the post-tibial pulse first. So what I'm going to do is I'm going to take my 2 fingers and I'm going to wrap it around the patient's ankle and find that little notch right before this process here. I'm going to squeeze down, Post-tibial pulse on the right side is +2. And now we're going to go ahead and look at the pedal pulse on this leg while we're here. And so what I want to do is I'm going to take my finger, go in between the big toe and the second toe, and slide down till I feel a little notch. And right here, I'm going to go ahead and palpate for the pulse. The pulse is +2 on the right side. Now we're going to go ahead and check the left side, beginning with post-tibial. I'm going inward, feeling for that notch. Pulse is +2. Moving on to the pedal pulse, same thing. Slide my finger between the big toe and the second toe, feeling that little notch. Pulse is +2. Now we're gonna go ahead and while I'm down here, I'm going to have the patient. I'm gonna check the patient's cap refill in her toes, and then I'll go check it in her fingers. I'm gonna pinch. Cap refill was less than 3 seconds in the toes, and check her other foot. Same as well. Checking in her hands. Cap refill less than 3 seconds. And this is true bilaterally. So now also I need to go ahead and check the patient for edema. So to do this, I'm going to lift the patient's pant leg up. And I want to just go across her shin and push down. And the skin bounces back in less than a second. So the patient is negative for edema. All right, child, you're doing an amazing job. Now we're going to go ahead and move on to assessing your abdomen. So I need you to sit in your chair. We're going to turn back and just scoot you over. All right. So I want to take this time to warm up my hands because I don't want the patient to jump off the examining table, aka my knee. And I'm going to lift the patient's shirt up. And as the patient just lays down, I can see that her abdomen is slightly rounded. The color distribution is evenly around, and I see no pulsations present at this time. So now, before we palpate, we want to auscultate so that we don't get the bowels moving too much. Don't do that, honey. So when we're auscultating bowel sounds, we want to go ahead and use the diaphragm of our stethoscope. So I want to just turn that back. And I'm going to auscultate her bowel sounds in a clockwise fashion, beginning in the right upper quadrant. Don't move your leg, sweetie. Don't move your leg. The patient sounds like she just had a meal. Her bowel sounds are active in all 4 quadrants, which is exactly what we want to hear. Now we're going to go ahead and move on to light palpation. And the technique I'm going to be using to palpate the abdomen is what I like to call a little roly-poly. And so I'm going to take, beginning with the heel of my palm, and I'm going to go across the entire surface of the abdomen and roll lightly. And come here. And I'm doing this technique to see if I feel any nodules, anything that's not normal here. And I'm going to take this time to also palpate the bladder. The patient's bladder seems not to be full because I'm unable to palpate the patient's bladder. So now I'm going to have her sit up. All right, 1, 2, and 3. And while we're back here, I'm going to go ahead and check the patient for any CVA tenderness. And so I'm going to explain to the patient, sweetheart, you're going to feel my hand on you, and I'm just going to hit my hand a little bit to see if you feel any discomfort, okay? All right, so beginning here. Did that hurt? All right, coming over this side. Did that hurt? All right, so the patient's clearly not experiencing any CVA tenderness because she didn't grimace, she didn't flinch, and she herself reported that she had no pain. Now we're going to go ahead and move on to my favorite part, a little bit of a dancing show as we test the motor function of her body. So go ahead and stand up. We're going to stand up and do some dance moves here. Come on and stand in front of me. All right, you can use this chair here if you need some balance, but I want you to put your hands out and in, out and in. Lift one leg up and stick it back out. All right, use the chair if you need balance. There you go. Lift the other leg up and stick it out. All right, stand up. Touch your toes. Wiggle, wiggle, wiggle. There you go. Stand back up. And I want you to go round and around. All right, good job. High five. All right, let's take a seat. So clearly the patient was able to perform these functions without any difficulty. So that means the patient was able to flex, extend, and rotate upper, lower, and the back extremities. So now we're going to go ahead and move on. We did test motor strength earlier when she pushed up against me with her legs and the arms. And again, motor strength was +5 out of 5. So now we're going to do a couple tests. So first we're going to test her hand and finger coordination. And we're going to be doing that by asking her to touch her nose. So sweetheart, I need you to take your hand out and touch it to your nose. All right, other hand. Touch it to your nose. Very good. So the patient is able to use her peripheral and able to notice that direct her finger to her nose. So now the next thing we're going to do is the heel to toe walk. Now it's important to know that at this age, being 3 years old, the patient is still developing her balance skills. So we want to make note of that as she performs these next couple of exams. All right, sweetheart, go ahead and take a step up. And we're going to have you come back here. Put your hands down, sweetie. And now we're going to be doing the heel toe test. So I want you to look at me. You see, look at my feet. I put one foot in front of the other. One foot in front of the other. Keep going. You want them to touch. Look, come back. You see how the back of my foot touches the front of my toes? Yeah. There you go. All right.
It's like a walk stage.
Yeah, it's like walking a stage. Very good. And now something else I'm going to have her perform is the heel to shin test. So come over here, sweetheart. Let me hold your hands for you. All right, so look. I want you to take your heel and run it down the front of your leg. Good. Other one. Very good. So the patient was able to pass and perform these tests considering her age. Now I want you can still stand, baby. I want you to turn around, face our camera here. And I want you to put your arms out. Palms up. Put your arms all the way out. Hold them out. All right, close your eyes. And this is the Romberg test. We can see that the patient is not swaying side to side and the hand is not dropping. So she passed this test as well. Go ahead, open your eyes and you can come take a seat. At this time, if I did have a reflex hammer, I would want to go ahead and assess the patient's reflexes, brachial and patellar. So with the brachial reflex, I would have the patient here in a little bit. And I'd extend the patient's arm out, placing my thumb over the brachial area, taking my reflex hammer, and I would hit it against my thumb. The brachial reflex would be present if her hand did twitch or if I felt a little jump back at me of her tendon to my thumb. And then with the patellar, I would just have the patient dangle their legs above the floor, take my reflex hammer and hit it under this little notch that's under the patellar here. And I would hit it, and again, if the reflex was intact, it would twitch. Or I could just take my hand and squeeze behind in her calf, and her toes would point downward because I would be activating that tendon in that area. All right, so besides the teaching that I'm going to do, after my entire assessment, I would make sure that the patient is comfortable, that they had the call light next to them, ask if they had any questions. But before I sign off, I want to go ahead and provide teaching for the patient and their parent. So a lot of, it's miscommon understanding that parents don't think that their toddlers in preschools need to floss. But actually, this is very important for children this age because in our day and age, many foods have high sugar content. And when we brush our teeth, the toothbrush is not able to get all the surfaces that we would want it to do, especially in between the teeth. And you'd say, well, why does a child this age need it? Well, at approximately ages 2 to 3, the children's 2 teeth begin to touch. So I'm going to go ahead and assess this in her. Yes, you do. Let me see. Open your mouth. Let me check your teeth. That's right. So I can see clearly that the patient has teeth that touch other teeth. So that means the patient is ready to floss. So, sweetheart, do you know what flossing is? So you know how sometimes when mommy brushes her teeth, after she brushes her teeth, she rinses and she gets her water pick and she goes in between all her teeth. That's flossing, but that's with water. I want to teach you how to floss with string. Have you ever done this before? No, see, I'm one of those parents. All right, so I'm going to teach her how to floss. So there's 2 methods. There's a common method where you wrap it around your finger, but for children her age, it's common and easier to do the loop method. So with the loop method, you're going to be taking a couple string and you're going to tie a knot and teach them how to use that loop to floss. But first, I want to let the patient get acquainted with this. So this is the floss box. How about you hold it, shake it, Understand it? Can you open the top for me? Alright, so you see how this is sharp? That means you always want an adult to cut this off for you because we don't want you to get hurt. So I'm an adult and I'm going to go ahead and cut you off a string so you can just feel what it feels like. Here you go. That's for you.
It feels like dog poop.
Alright. I've never felt dog poop, but clearly she has. Hey, we all have our niche. So now we're going to, what we would advise the parent to do is cut about 18 inches off of floss, which is what I have here. And then they will take the two ends and they will tie a knot. You can't really see it, but there's a knot here that is making a loop. And so with the loop, the patient will put 4 fingers in, and they will be using the index and thumbs to help direct the floss like this. And they will be able to push it in between their teeth and do C formations. So I'm going to let the patient go ahead and play with this. So put your hand, everything but the thumb. There we go. And I want you to hold the floss in between your fingers. Pinch. Hold on. The thumb and your finger. See how you did that? Same thing on this side. And so now that you have it, you can put it in between your teeth. And mom and dad, this will be an important time to help with your children flossing. Children usually can't floss by themselves until they're 8 to 10, but it's important to start building this habit now while they're young. All right, my sweetheart, do you have any questions for me?
I like to go to school.
You like to go to school? Yeah, I see that. I see you got your school shirt here. All right, so thank you for watching our health assessment video. Let's say bye.
Bye.
All right, and that's the end. Have a great one.